All right, let's talk about something you've probably heard of, beta blockers. You know, they're one of those medications that seem to come up all the time when you're talking about heart health. But what if I told you that the common wisdom about them, well, it might need a little bit of an update, especially if you or someone you know is over 60. So that brings us to the big question, right? When a doctor needs to treat high blood pressure, are beta blockers the automatic go-to medication, the first thing they reach for? Well, as we're about to see, the answer is a lot more complicated than you might think. First off, let's be clear. Beta blockers are a huge deal in heart medicine, for sure. They're used for a whole bunch of different conditions, and they've helped so many people. They work by kind of telling your body's adrenaline to take it easy, which makes your heartbeat slower and with less force. And boom, that lowers your blood pressure. But this is where the story takes a really interesting turn. You see, medicine is always learning, always evolving, and as new studies come out, the official advice can change. And lately, there's been a pretty surprising twist when it comes to older adults. And the key phrase here, the one thing you really need to lock onto, is high blood pressure alone. We're talking about a very specific situation here. An adult, over 60, who's dealing with high blood pressure but doesn't have other major heart complications. And here it is, the big takeaway. The official medical guidelines now say that for that specific group we just talked about, beta blockers are not the recommended first-line treatment. That's a huge shift from what a lot of people and even some doctors might have considered standard practice for years. And just to really hammer this point home, let's be super clear on the age. This updated advice is specifically for people aged 60 and older. It's all about tailoring the treatment to what the research shows is best for this specific group. So the obvious question is, why? Why the change? It's a great question, and it's not a random decision. This all comes down to some really important research about the potential risks versus the benefits for these patients. So when scientists really dug into the data, they found some eye-opening stuff. For folks over 65 with only high blood pressure, beta blockers just weren't as protective as other drugs. What's even more concerning is that they found an increased risk of strokes and just generally more negative side effects compared to other blood pressure meds. And this really shows you how important context is in medicine. You can't just say a drug is good or bad. A medication that's the lifesaver in one situation might not be the best choice in another. It's all about looking at a person's whole health story. Now, I have to pause here and make something absolutely clear. This is not me saying beta blockers are bad. Not at all. In fact, there are many cases where they are absolutely essential, life-saving drugs. The guidelines call these compelling indications, situations where you absolutely want them on board. This chart breaks it all down perfectly. Look at the left side. You're over 60 with just high blood pressure. Beta blockers, not the first choice. But now, look at the right. Same person, but now they also have something like heart failure. Suddenly, the script is flipped. That same medication becomes a critical first-line treatment. See the difference? So what are these compelling reasons we're talking about? Well, here are the big ones. If a patient has heart failure, or has recently had a heart attack, or has stable angina or atrial fibrillation, then yes, beta blockers are a cornerstone of their treatment. In those cases, their protective effects on the heart are just too important to ignore. And the story's got even a few more layers. Sometimes one blood pressure drug isn't enough. So a beta blocker might be added as part of a team of medications to get things under control. Also, there are special types called cardioselective beta blockers that are often a better fit for people who also have conditions like asthma or diabetes. Okay, so let's bring all this back to you. What does this all mean in the real world? How can you take this information and use it to have a better, more informed conversation with your doctor? If you're going to remember just two things today, let it be this. Number one, over 60 with only high blood pressure, a beta blocker is probably not the place to start. And number two, if you have other serious heart conditions on top of that, then that same beta blocker might just be one of the most important pills you take. And listen to this. The guidelines are incredibly direct here. They actually recommend that if someone in this situation is already on a beta blocker for just hypertension, their doctor should think about switching them to something more appropriate. Now, of course, and this is so important, you should never stop or change your medication without talking to your doctor, ever. At the end of the day, it all comes down to a really simple idea: personalized medicine. It's about making sure you are on the absolute right medication for the right reason based on your unique health situation,
One size does not fit all. So, we'll leave you with this final thought to take with you. Your health is a story with a lot of different chapters. The question is, does your current treatment plan reflect that whole story? That's a really important conversation, and it's one that's definitely worth having.